Welcome to the Chiropractic and Legal Injury Podcast, recorded live at our events. We're here bringing you the expertise, insights, and tools you need to navigate the world of personal injury care and to uncover what you didn't know about car accidents. It's no accident you're listening today, so let's get started. Welcome back to the Chiropractic and Legal Injury Podcast. I am Ashley here recording live at our conference. We are in beautiful Scottsdale at venue 8600, and I am so excited to dig into our next guest. So let's get started. Welcome.
Well, thank you for having me. Appreciate it.
My pleasure. Welcome. So tell us a little bit about yourself.
Well, my name is Dr. Clouse. I'm actually a practicing orthopedic surgeon here in the Valley. I'm born and raised here in Arizona. In Mesa, Arizona is where I was born and raised. Left to go do all my training out in New Orleans, out in Texas, and then eventually both me and my wife are from here.
Okay.
And so once we're done with training, it was kind of a no-brainer, like this is where family is. And so we've been here, and I've been practicing here getting up to about 17 years now. I've been practicing here in the Valley. So
That's amazing.
It's been awesome.
I'm going to have to pick your brain later about New Orleans because it's on my bucket list
It's
to go.
It's a wonderful place to be. We loved it there. Just loved it.
Beignets.
Yes. Oh my gosh. My kids grew up on those. They still want those.
I would come back just covered in powdered sugar. Absolutely.
Then you're eating it correctly.
Yes.
That's exactly how you're supposed to do it.
Absolutely. So I have these questions. I'm really excited to dig in. Let's go to the first one. As a medical director of Azure Healthcare IPA, can you share more about your role and how it aligns with the IPA mission?
Yeah, absolutely. So I'd probably be easier to start off with the latter half of kind of what is the Azure's IPA mission.
Yeah.
And so to really kind of understand what we've done is about 10 years ago, I got introduced to the personal injury world. Okay. Whereas before that, it was mostly commercial insurances. About 10 years ago, was introduced to it and kind of started to learn that world.
Yeah.
Okay. It is a little bit different than commercial, insurances, little nuances and things that you learn along the way, learning how to do, IMEs or just kind of doing all these sorts of things.
Sure.
As I took care of patients and I found that I became very frustrated with a lot of things in terms of just the availability of providing care for patients. Mm-hmm. Like an example, I hear this all the time where you want to refer out to a neurologist, for example, or another provider, and you can't find a provider that takes personal injury. Or if they do, the one person that takes it is across town an hour away for your patient. And I came across that so many times. And then as I've talked to other providers, I've seen it be a very much recurring thing. We also would see how everybody would do their own thing, but there was very little collaboration.
Yes.
The therapists were doing this, doctors were doing this, never really talk all that much, which is like terrible.
Yes. Communication.
And so you could just look at how medical care was being provided, and just me and my partner and our group were like, we can do better.
Yeah.
And so we formed this IPA, Azure Healthcare of Arizona IPA, which is a network of providers of over 30 specialties all across Arizona, well over 1,000 providers that are in our network that are there to now be able to provide care to particularly the personal injury patient.
Yeah.
That the personal injury patient isn't limited to just one or two guys that happen to take personal injury. Like, they have access to care
Options.
that is better than any other insurance plan as far as I'm concerned.
Yeah.
And so the role or the mission of our IPA is to be able to provide this higher level of care for our patient population, one of those patient populations being the personal injury. Okay. And now my role as a medical director is my job is to kind of oversee that care coordination. Like, my job is to make sure the providers we get are the top providers. Like, we want the best of the best providers in our network.
Yeah.
We want when I'm going to send somebody a patient or I want them to be going to the best neurologist I know, the best pain management. These guys are great. And so part of, as a medical director, is to vet to make sure we have high quality physicians,
Yeah.
high quality providers. It's to help in facilitating the referrals, help in facilitating the coordination, the collaboration, so that doctors, therapists, chiropractors, we're actually communicating better and creating a system that it's easy to do that in. Okay, it's one thing to say, hey, let's collaborate, but then it's a different when you actually need to do it. And so we've created this IPA with that in mind.
I love that you said collaboration too, because that's a big theme of this conference is really how collaboration transforms care.
It elevates it.
Yeah.
Absolutely elevates it.
It's amazing, and it really makes a difference for the patient, because if the patient is the most important thing, right? Making sure that all of those pieces not only fit, but that they are the best pieces that patient can possibly have to make sure that this traumatic moment that they're having is as easy as possible for them.
Oh, absolutely.
Yeah.
Absolutely. And it's amazing if you know, as a physician, if I know that they're seeing a certain therapist, either a chiropractor or a physical therapist, and I know what they're doing and I know what the plan is. Like, how does that not help me and be able to make my next decision on what I need to do for the patient? It elevates everything.
Yeah. I like that word, elevate. That's great. So how else do you find that it benefits the providers and patients and attorneys?
Well, there's let's see, where to start there. How about we start with the patients first? Okay, so I think that's the most important. Like, when it comes down to it, our main goal is to provide better care. And so for the patients, like I mentioned before, like the IPA provides this full network of care for patients. Over 44 different specialties, well over 1,000 providers in the network all across Arizona. So not only does it improve access for patient care, but it improves access that it's close by.
Yeah.
Like if you live in Wickenburg, you don't have to drive way over to South Phoenix because that's the only provider. No, there's someone that's close by for you. And so it improves access to care for the patients.
Yeah.
It improves the quality of care. The way the network is set up, like we talked about, is that it does help our providers to easier collaborate so that the actual treatment plans are better. And so what is that going to do to the patient? It's going to get them care faster.
Yep.
They're going to recover faster. And so for that, that's fantastic.
Yeah.
The way I view it is that when someone gets enrolled in our network, I view it as this is like the best healthcare plan like in the state, hands down. Like, there's no other healthcare plan that's better than this for the patient. So you're like, oh my gosh, this is great for them.
Yeah.
Now for providers, it's fantastic because one, if you're one of our providers, you get a steady referrals. I mean, it helps grow your practice on patients you probably didn't have access to before. It allows you a system that it's easy to be able to collaborate with other doctors. It actually has a system that you have access to all of the medical records. So even though you send someone out to someone who's not in your group, you still have access to their records. So I see someone, I think they need to see a neurologist. How many times have I sent someone to a neurologist and then the patient comes back, I'm like, looking through my chart, they didn't send the note back, which again happens all the time, unfortunately. Yeah. So I'm relying on the patient to say, well, what did the neurologist tell you? And then they're trying to translate what a neurologist said.
Right.
And
remember.
Yeah, and try to remember and then try to, articulate what they said.
Yeah.
And so you're kind of as a doctor going, okay, I think I know what they're doing, Maybe. Okay. But with this, it's nice is that if it's a patient in our network, or I'm sorry, a provider in our network, I have access to those records. I can just log onto our portal, pull up the note and go, oh yeah, I know exactly what your neurologist said. And I can look that up before the patient gets there. I already know what's going on.
Yeah.
So, I mean, again, it just helps elevate everything.
Lots of ease there.
Yeah. It eases a bit. Now for the attorneys, that's nice because one, you're providing better care. I think that's hands down the most important thing. You're providing better care. There's not a gap in treatment. That's happened so many times where, again, we were talking earlier, how sometimes patients, they don't quite understand it. And then sometimes they don't know where they're supposed to go sometimes. And their care gets dropped. I've seen it so many times where with the system, the IPA helps monitor that. It helps try to prevent that. If let's say a patient misses an appointment, Well, the attorney gets a little email that says, hey, your client such and such missed these appointments. So the attorney knows what's going on, and the attorney has access to those records as well, just like the medical providers. So for an attorney, they can know exactly what's going on with their patients at all time, literally at a click of a button. And then when the case is done, instead of them having to run around to gather records all over the place, it's one place. Click. There's all my records. Oh my gosh, how much time did we just help save them, and then just accelerate and help the case?
Yeah, absolutely. Time is of the essence.
Oh my gosh, absolutely. Absolutely.
For sure. How do you ensure that providers maintain the access to their treatment plans, even with referred and within the network?
Okay. So, I mean, I've kind of mentioned this before, but to kind of clarify. So whenever someone in any provider in a network sees a patient, makes a documentation, gets labs, imaging, whatever, all the documentation comes back to the IPA. So even though we're all independent practices and we're not necessarily connected by practice, we're connected through the IPA. So all documentation ends up funneling back to the IPA, and we put it into a portal that has access to those people who are responsible for that patient. So for example, other providers have access to that portal, so they can look up and see any patients that they've done. Like I said, the attorneys have access to this. But what's nice for our providers is that if they refer out, they're never going to lose that patient. You know, they don't have to worry about like, oh, I send out and I'm never going to see that patient again because that provider is going to, who knows what they're going to do.
Right.
They always can find and look up and see what's going on. Okay, that's nice. It helps them because of that, it makes it easier to, if like, hey, I want to reach out to that. So let's say I have like a chiropractor that's out, you know, kind of buying a solo chiropractor, for example. You know, I've heard sometimes they're maybe hesitant to refer over to the orthopedic surgeon.
Absolutely.
Because the orthopedic surgeon kind of takes him, then boom, like they go off this direction.
The magic trick.
Yeah, and then all of a sudden the chiro's like, hey, that was my patient, you know? Whereas in this type of situation, like they don't have to worry about that happening because they can refer over to the ortho. If they want to see exactly what the ortho did, they can look it up. They can actually reach out to the ortho, make it very easy to send a text, email, like call. Like it's meant for us to be able to work together. And so that way, that way you don't have to worry about, you know, losing people.
Sure.
Because when you're in our network, you're on our team. We're a team.
Yeah, I feel like that team mentality is so important too for treating patients. And
it's the only way it works.
Collaboration, transforming and elevating care.
Yes.
Yeah. So speaking of that collaboration, how do you collaborate with attorneys to help build stronger, more complete cases for the clients?
Well, I think we kind of mentioned that with the attorneys. I feel like I'm kind of a broken record a little bit, but I do think that's important because to know is that, you know, providing a comprehensive care to the patient that has multiple, like, you know, over 44 different specialties, having access to doctors being able to easily collaborate and to talk is going to elevate the treatment plans. Our goal is everyone's going to be on the same page. We're on the same page. So that's going to improve the care that's being provided, thereby, you know, accelerating the recovery and moving the case along. Okay, so that, I think that in and of itself is going to help build the case for the. Plus, with the IPA, it has the ability to have some oversight, which I think sometimes you don't have that. Like I said, you know, previously when I was doing personal injury, you know, people kind of doing their own thing. You know, with the IPA, there is a little bit of oversight so that we can make sure that we're not wasting time, we're not wasting resources, you know, and so that's important because you know, there's times where patients may disappear, you know, and nobody knows about it because there's not a single kind of entity watching over that, and that's what the IPA can help do. And so it can help make sure that the case stays solid. And then obviously with the patient portal, having all the documentation in one location, one centralized location, like now the attorney's offices, they don't have to call 6 different offices, talk to 6 different people, try to get 6 different people to fax over the records, and then when they don't fax them, call them back again, and then, oh, they didn't send it or they forget to send it. Whereas now it's just one phone call, or it's actually one click. It's all right there on the patient portal. They just can hit print. I mean, how much time have we saved them and helped speed the case along? So that's I think, huge.
Prevent lots of things falling through the gap.
Absolutely.
Right? Yeah, that's amazing. What role, as you kind of said, does teamwork play, and how does it impact patient outcomes?
Well, obviously we mentioned this, but teamwork's like huge.
Yeah,
And
it's a
so
big thing.
I learned this about 10 years ago. I started a multidisciplinary clinic. And so it was a clinic that we had orthopedic surgeons, we had pain management, we had family practice, we had physical therapists, we had chiropractors, we had personal trainers,
Yeah.
and we had it all under one roof. And one thing that was really nice about this was, if let's say I had a post-op patient, I did a patient's ACL reconstruction, and maybe they're not doing very well. Well, all that would have to happen is the physical therapist, and this would happen all the time. The physical therapist would just walk over to me. We're on the same roof. He's in the room next door.
Yeah.
He would just say, "Hey, Dr. Clouse, can you come look at this patient for me real quick?" And I would just walk over there. Right there on the bed, me and the physical therapist would be sitting there talking about this patient and saying, "Okay, what do we need to do?" You know, I've had times where I did a hip replacement, and after the hip replacement, the patient was struggling with back pain because their mechanics have changed. And so we would be sitting there and going, "Okay, your back's starting to hurt you now?" It's like, "Hey, let's go grab our chiropractor. Let's have the chiropractor maybe add some
Yeah.
treatments." And we would literally organize it and get it all set up right then and there on the spot. So there was never a delay in treatment, and the patient got better and they got treated, and it just accelerated their recovery like just amazing outcomes we were getting.
Yeah.
And so, and one of the reasons why that works so well is because, well, one, we're all under one roof.
Yeah.
It was very easy for them to walk over to the room next door to find me.
Yeah.
It was very easy to do that. Now, imagine if we can do that and expand that statewide. If we can have that same collaboration, that same teamwork, but we can do that across the entire state of Arizona. That's what the IPA is trying to accomplish. You know, by being able to have access to medical records, being able to work through the IPA if you ever need to, coordinate care or talk to somebody. We facilitate that. And so that way we can recreate that type of an environment, but with everybody.
Yeah.
And if we can do that, all it does is it's going to make these cases go so much better. I mean, I've seen it.
Yeah.
And I've even seen it already in our IPA. I've seen that process work. So it's great.
Do you have a particularly memorable case, or
I can tell you.
I got stories for days.
I got stories. We can go all day long here, okay? Well, I would say I can give you two examples. How about that? Okay, I'll give you a good one and a bad one.
Okay.
So now if you look at the good one, both of these patients, interestingly enough, I just saw them over this past week.
Oh,
okay,
wow.
so it was like
Recent.
these are very, very recent. So one of them was this was a college girl who was in a bad motor vehicle accident. Got taken to the emergency room, had a concussion, so had some traumatic brain injury, but kind of had all the x-rays, images, everything was negative. She got discharged. Well, she happened to come to see me just a couple days later, which is really great. I got to her really, really quick.
Yeah.
And so while I'm in the process of working her up, and she had shoulder pain, she had a bad knee injury, the typical neck, low back symptoms. As I'm kind of going through and saying, okay, here's what we're going to do. We're going to do this. We're going to get some therapy. We're going to get some chiro. We're going to get some images. As she was trying to talk to me, you can tell that she was struggling with speaking. Like when I would ask her a question, like, hey, can you point to your shoulder where you hurt? And you can just see her just pause, and it took her so long to go here, Wow. And the whole time, and as I'm starting to talk to her and ask her questions, she was able to communicate how she knows what she wants to say, but she just can't verbally express the words. She's having tough time as she kind of saying, just everything's scrambled up there is how she kind of described it. So obviously looking at that, you're thinking, okay, I'm worried about, traumatic brain injury. It's like, I need this patient to see a neurologist. So with the patient still in the room, I literally said, hold on. I walked out. I literally called our contact over at the IPA and I explained the situation and said, hey, I got a patient. I need her to see a neurologist like now. Now, if you've ever tried to call sometimes, and you call these, specialists, sometimes it takes a while to get in. Well, because the person's in our network, they got a hold of them. We got her in it was either the next day or the day after. I mean, it was just, we got her immediately in. She got her brain, she got an MRI of her brain really quick. And then she got, her treatment started right as we were also kind of starting our other treatment like that. So I was able to keep doing her therapy and some injections, and we were able to get her going. But at the same time, I was able to see what the neurologist was doing, and they were getting that going.
Yeah.
And in just a matter of this happened right in the fall. That I just saw her last week. She was doing fantastic. She only had to take a semester off of school.
Hey.
She was getting ready to head back down to U of A.
Yeah.
She's there now, but she was taking a full course. So she had already recovered enough. I mean, she still got a little bit ways to go, but that was an example of just how we were able to kind of facilitate just advancing the care of a patient. And that's how it should work.
Yeah.
Okay. Now I'll flip the
other
script, the other
Yeah.
side. I saw a patient this week who was in a motor vehicle accident back in the fall of 2023.
Okay.
Got really bad, got rear-ended really bad, and initially was complaining a lot of neck pain. Okay, and so initially he immediately got in and started therapy, and everything. It was like, oh yeah, that sounds perfect. That's exactly what I would want. You know, he's getting his therapy. About 8-10 weeks go by, and he just kind of plateaus, not really advancing. Seems like the neck pain and now the shoulder pain, arm pain getting worse.
Uh-oh.
So they get some images, see some findings on his neck MRI, send him to go to pain management to get some x-rays. Again, totally reasonable. You're like, this is perfect, exactly what you want to see happen.
Yeah.
Goes in and sees the pain management, gets three injections.
Okay.
Injections don't do anything. Okay. Now this is where there's a breakdown where then now it's kind of like, patient didn't quite know what to do, didn't know kind of where to go, and he's kind of an independent guy, so he's like, I'll just be fine, and then kind of got this, good guy, really good guy, smart guy, and he thought, hey, this is just going to go away on its own. And so what happens is 2-3 months go by, no treatment, not getting better. Finally, he's like, okay, I got to do something.
Yeah.
Maybe they say, well, you should go see a spine surgeon. So again, takes another month, 2 months to get into the spine surgeon. So now we've had this lapse of care for about 3 or 4 months.
Yeah.
Gets in to see the spine surgeon. He looks at it and he's like, I don't think you need surgery. And then again, nothing really happening with his care, you know?
Yeah.
And so finally, I think the spine surgeon said, hey, let's check your shoulder. Orders an MRI of the shoulder. And of course there's the guy's got some inflammation, a rotator cuff tear, in addition to his neck stuff.
Ouch.
And so finally he came in to see me for the shoulder, and I'm like, yeah, you got all this shoulder stuff we need to work on and we can fix.
Yeah.
You know, so now he's getting the care. But what would have happened if we had our network in place and he was, you know, if the minute we saw that, hey, a month has gone by and nothing's happened, there would have been an alert. There would have been a flag would have been raised to say, hey, what's going on here?
Yeah.
We could have facilitated him in getting to the spine surgeon quicker, facilitate him if it was the shoulder MRI, get in to see. I mean, I feel bad because, you know, there could have been a chance that this guy could have already been recovered and been done by now.
Yeah.
So those are the types of things that we hope to be able to correct, to prevent, and get better outcomes.
That's awesome.
Yeah. So those are kind of a couple of examples of how we've seen it work.
That's awesome. Okay, so my last question for
Yes.
you is, if you had one piece of advice for every person who gets in a car accident, what would that be? One thing you wish they would know.
Well, the probably the biggest thing I would tell people is ask a lot of questions and don't be afraid to sound stupid, because like even me, when I first started getting into personal injury, I didn't understand personal injury. I had to sit down with a lawyer and say, explain to me what this is and what that is.
Yeah.
You know, why are you guys doing this? Why are you doing that? And so it can be a confusing world if you don't understand it.
Yeah.
And so it's important to ask a lot of questions, and don't just nod your head when maybe you're talking to your lawyer and he's explaining something and you're going, nope, no idea what you're talking about.
Yep.
It's okay to go, stop.
Yep.
Can you explain that?
Yeah.
You know, just tell them, explain it to me like I'm 5 years old.
Absolutely.
Make it so simple for me. And same thing when you go see your doctor, you know, and the doctor, because a lot of times in personal injury, it's not like they're just coming with one thing. You know, they usually, it's my neck, it's my shoulder, it's my back, it's my knee, it's multiple things. And so sometimes, you know, things get like thrown at the patient, and I'll admit I probably do this too. Like, you know, you're like, hey, look, we're gonna do this, and on your knee, we're gonna do this, and on your shoulder, and the patient's like, whoa.
Yep.
And it's okay to say, can you just stop and just explain it to me very simply?
Yeah.
You know, and it's okay to do that, because the more informed you are, you can, you know, the more informed you are, the more ownership you'll take.
Yeah.
Because you need the patients to take some ownership in their care.
Yeah.
And if you can, and it goes back to the teamwork. Like, I mean, I know we've been talking about doctors, team working with other doctors and with attorneys, but I include the patients with that.
Yeah.
Like in my version, like the patient is just an equal member of the team as the physician, as the attorney. And so you want them to be invested, take ownership of their care. And so they'll do that more if they understand.
Yeah.
If they don't understand, they tend to be quiet.
Yes,
okay, is what I found. So ask questions.
That's awesome. That's great advice for everybody out there. Well, thank you so much for joining us today. This has been awesome.
Well, thank you. Thank you for having me. I appreciate it.
Absolutely. We can't wait until the next time.
Thank you.
All right. From all of us at the Lazzara Law Firm and the Chiropractic and Legal Injury Conference, thank you for listening. We hope you never need us, but if you or someone you love does, know they'll have a team dedicated to helping them rebuild, recover, and reconnect with what matters most, their loved ones and the life they deserve. This is the Chiropractic and Legal Injury Podcast, where knowledge is power and collaboration transforms care. If today's episode opened your eyes, share this episode with your network and help spread the word about the realities of personal injury care. Follow us on social media to keep learning and connecting with this incredible community.